Great. So in the interest of time, we're going to just move right through to my presentation next, and then Dr. Elena's presentation. We're going to skip questions and have them all at the panel session at the end of the last session. So, but we will have a short break after Dr. Elena's talk, and then we'll reconvene for session 4, and then the panel discussion at the very end will be for session 3 and session 4. Okay, so now Vasanti Malik. I'm a research scientist in the Department of Nutrition here at the Chan School, and I'm going to be talking about consumption of low-calorie sweeteners. I'm going to take a note from Dr. Mattis, and so I'll try to use low-calorie sweeteners throughout my talk, and chronic disease risk. Couple disclosures. Okay, and so the use of low-calorie sweeteners in the U.S. Really started to increase, I guess, in the 1980s. We can see here on this graph that they entered the market in the mid-60s, and we can see a steady increase over recent decades. And this sort of tracks along with the rise that we've seen in obesity rates as well, and that's not surprising, since when you think about what low-calorie sweeteners are, these are additives that contain few to no calories that offer a sweet flavor. So, so really nicely can be used for, in theory, controlling calories. If we look at the top of the graph, we can see there's a number of new products containing artificial sweeteners entering the market, so in more recent years. And I like the, if we look at the bottom, we can sort of see the timeline where these artificial or low-calorie sweeteners have been in the food system for quite a while now. And so when we look at the main sources of low-calorie sweeteners in our diet, they're really coming from beverages, and that's true for adults as well as for children and adolescents. And this is data from NHANES. And we can also look at the percentage of the population who consumed diet drinks on a given day, and this is data from NHANES, and we can see there's been a steady increase over time since the year 2000, and then we can see a sort of slight dip happening in more recent years, and that does seem to be the case, along with a slight decrease in sugar-sweetened beverage intake. We're also seeing a slight decrease in diet beverage intake with an uptake of water intake. So this is more data from NHANES that's actually showing the percentage of the population who consume diet drinks on a given day by race and ethnicity. And we can see that this is really driven by non-Hispanic whites. So we can see that there's higher intakes of diet drinks in non-Hispanic white populations compared to Hispanic and non-Hispanic black populations. And similarly, we can see when we look at diet drinks by poverty, the poverty income ratio, again looking at data from NHANES, we can see that it's really in the higher income groups where we're seeing higher consumption of diet drinks compared to lower income groups. And this may have relevance when we get talking to some of the policy implications in taxation. This does have some relevance when we start talking about the regressive nature of soda tax. And this is some data from Barry Popkins and Corina Hawks that shows the sales of diet beverages in the global context. And we can see, of course, US and Canada leading the way. But if you look in panel B, there is this slight drop in sales of diet beverages. And then at the same time, we're seeing some increases happening in some other parts of the world. And so Dr. Mattis showed a similar slide. So looking at the magnitudes of sweetness from a number of these low-calorie sweeteners, and this is just a list of FDA-approved low-calorie sweeteners in the market. Some of them, such as saccharin, have been in the food supply for a long time, as well as aspartame. Point is, they are very sweet. Say they activate sweet receptors at very low concentrations relative to sugar. And again, as Dr. Mattis's point's well taken, these are all very different chemicals. And so, despite being in the food supply for a long time, if we look at the recommendations for low-calorie sweeteners, there's not a clear sense when we look at the recommendations. The recommendations are are quite general and not entirely consistent. So if we look at the dietary guidelines, the 2015-2020, the overall conclusion is replacing added sugars with non-nutritive sweeteners may reduce calorie intake in the short term, but little is known about long-term effects. And then if we look at the Dietary Guideline Advisory Committee, their conclusion was added sugars should be reduced in the diet and not replaced with low-calorie, non-nutritive sweeteners, but rather with healthy options such as water in place of sugar-sweetened beverages. And then we turn to the American Diabetes and American Heart Associations, and the conclusion from a statement that was published a few years back now is that at this time there are insufficient data to determine conclusively whether the use of non-nutritive or low-calorie sweeteners to displace caloric sweeteners in beverages and foods reduces added sugars or carbohydrate intakes or benefits appetite, energy balance, body weight, or cardiometabolic risk factors. So really, we're not seeing a whole lot of consensus here. And I understand that there's going to be an updated statement from the AHA on low-calorie sweeteners coming out in the coming months. And so when we look at the totality of the evidence linking artificial or low-calorie sweeteners to cardiometabolic outcomes, we see that there are discrepant findings between trials and cohort studies, and this might sort of underscore why there's this lack of consensus in recommendations. And so trials generally suggest a beneficial or neutral effect of artificial or low-calorie sweeteners on weight management and some cardiometabolic risk factors, especially in the context of intentional weight loss. But as Dr. Mattis pointed out, there are a handful of limitations from the trials. Number one, they don't really reflect real-world consumption patterns. There's also issues with the choice of the comparator group. Are they being compared to sugar-sweetened caloric sweeteners, or are they being compared to water? And then, as Dr. Mattis mentioned, there's also small sample size and short follow-up, which really precludes the ability to look at the relationship between low-calorie sweeteners and clinical outcomes in the context of trials, which is where we go to the observational studies. And as it were, the observational studies are also quite mixed, with the majority reporting positive associations with cardiometabolic outcomes, so adverse associations with cardiometabolic outcomes. But at the same time, we do see some studies that are showing there are no associations. So what's happening? We know with the observational studies, many are prone to this reverse causation, and this came up yesterday as well. And so reverse causation is this process by which an individual who is already overweight or who might be having underlying risk factors for cardiometabolic disease might choose artificially or low-calorie sweetened beverages or foods as a strategy for managing their health. And so we see this spurious positive association between the artificial or the low-calorie sweetener and the health outcome. There's also residual confounding by other dietary behaviors or lifestyle factors. There's always this issue of problems with the dietary intake assessment methods and observational studies. So these are some of the limitations that are I guess, plaguing the observational research. And just a little note, I'm not really talking about the animal studies, but there are some adverse associations that have been noted in the observational data that are supported by some rodent studies. And I think Dr. Mattis's point is really well taken, where it seems that maybe this is a function of what actual sweetener you're looking at, because they do seem to be quite different. And so Dr. Mattis also talked about this meta-analysis that was published in the Canadian Medical Association Journal last year. And I'm pointing this out because I think it really shows just how much confusion there is in this field. And so this meta-analysis, the overall conclusion was that evidence from RCTs does not clearly support the intended benefits of non-nutritive sweeteners for weight management. Well, if you look at the meta-analysis, the authors didn't really consider the comparator groups, and it's not clear how studies were selected, and so there's that issue. And then with the observational data, they concluded that the data suggests that routine intake of non-nutritive sweeteners may be associated with increased BMI and cardiometabolic risk. And now it seems that, as I was saying, a number of the observational studies have this issue of reverse causation, and the meta-analysis isn't the right setting to be able to tease that out. And so I think it's really important to look at individual well-done studies when we're trying to understand the associations or the relationship between low-calorie sweeteners and cardiometabolic health outcomes. And so this is a study that we did in the 3 Harvard cohorts a couple years ago, looking at changes in different beverage intake and long-term weight gain. Frank, who showed this slide yesterday, but I think just to make the point, when we look at and so this was looking at weight change over 4-year periods across decades of follow-up in the 3 Harvard cohorts with over 125,000 participants. And what's unique about these cohorts is that there's repeated measurements of diet, so we can try to, as well as lifestyle factors and health factors, so we're able to try to statistically get at some of these reverse causation issues when we're looking at the relationship between the diet, drinks, and health outcomes. So here, when we look at our results, we can see positive associations between sugar-sweetened beverages and fruit juice and long-term weight gain, but we see the converse, so less weight gain associated with intake of water, coffee, tea, and diet drinks. Right there. And so we also did a substitution analysis in this study where we substituted, we modeled the association of substituting more healthful beverages for sugar-sweetened beverages and fruit juices. And if we look on the bottom, there, we can see that if you substitute 1 serving per day of diet drinks for sugar-sweetened beverages, there's about a 1 pound less weight gain in a 4-year increment. So what this is telling us is that diet drinks are beneficial for weight gain when we're looking at our long-term data. So a number of studies, prospective cohort studies, have also looked at the relationship between diet or low-calorie beverages and type 2 diabetes. And this was a meta-analysis that was published a few years back from the group at Cambridge. And they looked at sugar-sweetened beverages, which is shown in the top part of the meta-analysis, and then the low-calorie beverages in the bottom. And I sort of circled and this is a busy slide, so I've circled the overall estimate in the forest plot for the low-calorie sweeteners, and we can see when the individual studies are not adjusted for adiposity, there's a positive association. There's a 25% increased risk of diabetes per 1 serving per day increase in the low-calorie beverage. But when the studies actually adjusted for adiposity, we can see that association is attenuated to 1.08. So really trying to get at this reverse causation issue. But again, meta-analysis is probably not the right setting to do this, putting together all of the individual studies, which themselves might not have done a very good job trying to address this reverse causation and other potential biases in the individual study. So the overall, that's reflected in the overall summary estimate, which may not be as meaningful as we hope.